is Heather Cole, and I'm a licensed physical therapist assistant with Orthopedic and Spine Center Physical Therapy. I'm here to talk to you today about taping as an adjunct to your physical therapy treatment. Taping can be used in many ways to help to facilitate muscles, inhibit muscles that are overworked, or mobilize a joint without the use of your therapist's hands. It's really nice to be able to take a piece of your therapy home with you over a few days after your session. We have two different types of taping that we can use. We have kinesio taping, which is a flexible tape that doesn't limit any range of motion. It's really good for the facilitation of muscles when that muscle just isn't firing the way you need it to. We can use that tape to help stimulate the muscle to do its job so that you feel better. We can also use that tape to decrease tightness in a muscle. When that muscle is overfiring, the tape will help to relax it and help it calm down so that it can do its job in a better way. The two different types of taping look a lot different as we have on our model here. Kinesio taping is this nice blue tape. It's flexible and it moves, so you can see that it does not limit her movement in any way. She's able to move through her full range of motion without any difficulty. When we have a muscle that's a little bit tighter or joint that needs to be mobilized, sometimes we have to go to a more rigid taping, such as the one on her left side. Excuse me while I cross over. This taping is done in two stages. We use a base layer to protect the skin because this top layer of tape is a little more rigid, and we're able to use this tape to really pull and really tell that muscle what we want it to do. So if this muscle is tight, by taking it and pulling it down, we're telling it to calm down and relax and just kind of sit there in a nice place. This muscle typically will elevate the shoulder like this. So when we pull it down, it just calms it down and lets it relax. Both tapings are effective. This one is a little more rigid. It does restrict motion a little more, so you'll see if I pull how the taping kind of pulls through this area. But when we have a tighter muscle, it can be much more beneficial in order to calm that muscle down. This type of taping, which is called a leuko tape, is also good for joint mobilization. We can take this tape and actually pull it taut and mobilize a joint so that it's like taking your therapist's hand home with you. When you're in your therapy session and your therapist is mobilizing your joint, when we stop, that joint hopefully will stay more mobile, but if we adjunct with the taping technique, we know that that mobilization continues throughout your day-to-day activities and you're able to get the greatest benefit from that mobilization. Taping in itself will not fix everything, but it's a wonderful addition to your therapy program if it's found to be necessary. Please talk to your OSC physical therapist about taping and whether it's right for you.